grateful for the donations that the people who aren't here have made. It's going to make it possible for us to meet our commitment, to help make it possible. And 4 out of the 5 of us who sit on the board of Health Reach are here. It's myself, Erin Liddell, Sheldon Roth, and Mitch. And our thrust right now is to have the funding to support the 5 medical students who need to stay in school this year. 4 out of the 5 medical students will graduate at the end of this school term in Tanzania. So we are doing other things as well in Nepal, especially right now. This year we provided funding to buy tin for shelter and roofs in a village called Dharka. It's in northwest Nepal, and they were really badly hit with the earthquake. And we've just, actually this morning I committed to us providing a wet program, which is people from ENFO in Nepal were trained by COST here for the Center for Affordable Water and Sanitation Technology. And so the people in Dharka will be trained to provide clean water. They will have proper sanitation, meaning toilets, and those are the 2 things. And so they'll be trained for those 2 things. So they'll know how to build them properly and how to maintain them. So we just concluded that discussion today. But tonight our focus are the medical students because they're the most important. The Vice Chancellor at Hubert Kairuki Memorial University informed me a couple of weeks ago. He said, do you realize that when you have graduated the next 4 doctors, which makes it then 24 doctors that we have helped graduate at the medical school at Hubert Kairuki, you will have graduated 24 doctors, and that will serve 500,000 Tanzanians. And I don't know what to say about that. It's we're so small, and yet we're actually able to make a real difference. And 100% of the funds that we have, 100% of the funds that we have go forward because we don't have any overhead, we don't have any salaries, we're all volunteers. So without further ado, I'm going to introduce Sheldon, who is going to introduce our speaker, Anthony.
Thank you, Val. So I'm Sheldon, and it's really a great pleasure for me to introduce Dr. Anthony Liwa. We call him Tony, okay? It's less formal, and he likes to be less formal at times. I first met Tony when we were in Mwanza in Tanzania, and he was one of my hosts, and it was really a great pleasure to be with him. I saw such a great interest in further studies and interest in medicine that we talked about probably trying to get some relationship. And actually, how it worked is that we have a University of Calgary Medical School, which is now called the Cummings School of Medicine, by the way, and the school that Tony's at is called the Catholic University of Health and Allied Sciences. It was formerly the Real Uganda University, but it's changed names. It's in Mwanza, that's north, okay, north of Dar es Salaam. And Tony is there as an assistant lecturer at the Catholic University. What we did is we arranged for Dr. Liwa to come to Calgary and to do a PhD. Now, it's a program, we call it a sandwich program because his school and our school really are both hosts for him to do the program. So he comes here for 4 months, he goes back for 4 months, comes back for 4 months, and it's going back and forth. And to do the PhD will probably take him X number of years. I don't like to mention how many, but you can imagine it's going to take him quite a considerable length of time. He's doing research, and I think he'll tell you a little bit about it. So we got him in as a candidate, and he was officially accepted as a graduate student. He's working with two very well-known and experienced researchers at the university, Dr. William Cole and Dr. Donna Slater, and he'll tell you the research he's doing. So it's quite exciting. Now, we thought, Val and I thought that he should really come maybe to meet with the group is he's actually a graduate of the Hubert Kariuki Memorial University, what we call HKMU. And Tony got his MD from that university in 2004, right? Okay, I didn't write it down, but I remember. And so this university, as Val's probably told many of you, is in Dar es Salaam. So he knows Dar es Salaam, and he was recruited up into Mwanza. He's not funded by, I want to make it clear, he's not funded by Health Reach Canada because he's actually not a medical student, he's on faculty. But over here, he's funded by other resources, fortunately, so he can do his studies in Calgary. But we thought he'd like to share some of his experiences because he knows what it's like to be a student in HKMU. He's gone through that experience. He knows the students as well. The students are similar in both, all the universities there. The medical students, they all have difficulty getting funded. They all have difficulty surviving, really, without funds. And so he'll be glad to give a couple of words and answer questions. And I think he'd like to answer questions. Yeah, I just want to point out a couple of things, though, because this man, I'll call him young man, because he's young compared to me, he's not sat around. He's been quite active, and I want you to know that after his MD degree from HKMU, he went to Stellenbosch University in Cape Town, South Africa, and he received a Bachelor of Science, honors in medical sciences, and that's a degree separate from the medical degree. That was in 2007, 2008, okay? 2009 to 2012, he went back to Stellenbosch in Cape Town, South Africa, and then you weren't there full-time. Were you there full-time? Full-time. Full-time, okay. So you were there for 3 years, and he obtained a Master's of Science in Medical Sciences. He wasn't satisfied, though. So in 2012 to 2015, he got another Master's of Science in Clinical Epidemiology and Health Services Research at the Weill Cornell Medical College in New York. Now, when Tony works here, he works hard. He works a lot of hours doing his research and taking courses. Then when he goes back to Mwanza, he actually has to catch up and pay back all the teaching that he's missed, all the supervision that he's missed, and all the administration that he's missed. So he's a busy man. But it's such a pleasure to have him here. And I'd like to say a few words.
Yeah.
Okay.